Hi guys, I'm Jacob Hazel and I'm doing this just to provide information about drugs and its related issues. And this information were based on my studies from college or through reading medical books or some scientific journals and from my experiences from hospitals or some trainings which I have attended. Okay, first we'll go to the brief introduction about pharmaceutical dosage forms. Commonly known as medicines, which are mainly classified into four categories. The first one is the solid dosage form, semi-solid dosage form, liquid dosage form, and the fourth one is gaseous dosage forms. Okay, then we'll go to the first category, solid dosage forms, and in these solid dosage forms, they were classified into again like the first one is the bulk solid dosage forms and the unit dosage forms. And unit dosage forms includes those tablets. Example is this plain paracetamol tablets and capsules and or and the second and the third one is lozenges. I don't have the examples here. So lozenges, which includes those Vicks or your strepsils, they're called lozenges. Okay, so they comes under unit solid dosage forms. And then the second class for solid dosage forms is bulk dosage forms, which includes I have an example here? No example. Okay, bulk solid dosage forms includes those powders or your dusting powders, those candid powders, antibacterial candid powders, or your powders, ORS powders, or your granules, sachets. This comes under all these bulk solid dosage forms. Okay, so the second category is semi-solid dosage forms, and in these semi-solid dosage forms, those creams, ointments, gels, your lotions, or even the pessaries and the suppositories comes under the semi-solid dosage forms. Okay, and then the third category is liquid dosage forms. This liquid dosage forms is broadly classified into two again, like the monophasic and the biphasic dosage forms. In monophasic, they are broadly categorized into four types again, like for internal application, for external application, and for used in oral cavity like in the mouth, and lastly which are used in the body cavities like the ear, nose, or eye. Okay, then we'll just go to the first type, that is for internal application. So liquid which are used in internal application includes your syrups. The most common one may be the syrups, and then the mixture, elixirs, linctuses, and lastly those parentals. Okay, and when we say parentals, it includes all these injections, ampoules, or your glucose drips. Okay, all those comes under these parentals. And then we go to the for external application, those liquid which can be used externally, like example to the skins. This includes lotions, liniments, those colloids, and those paints, medicated paints. Okay, and then the third class of this category is those which are used in the oral cavity, the mouth, like it includes those antibacterial gargles, mouthwashes, or your throat paints for those throat antibacterial throat paints. Okay, and then for the fourth one for this category is those which are used in body cavities. This includes your the chest, your ear drops, eye drops, and what else, eye drops, and nasal drops. Okay, this comes under liquid dosage forms which are used in the body cavities. And then the second class for this liquid category is the biphasic dosage forms. And biphasic means that which has two phase, like the solute and the solvent, or the those which are which has two two parts in the bottles which need to be shaken before use. This includes the emulsions and those emulsions and the suspensions. And then lastly, we'll go to the fourth category. The fourth category, gaseous solid dosage forms. Okay, in gaseous dosage forms, I mean gaseous dosage forms, not solid dosage form. Gaseous dosage forms includes those aerosols, sprays, respiles, inhalers. Okay, and then that much is the main pharmaceutical dosage forms commonly marketed in India. So next we'll go to the preventive measures and the cautions we need to consider while using medicines. Okay, thank you for watching, and please like and subscribe, and if it's worth, you can share it as well. Thank you. Hi again. Now we'll talk about some precautions and preventive measures we need to consider while using medicines. First, we'll take the most common one, tablets. Okay. Tablets are of two types. Like it could be uncoated tablets, plain paracetamol example, or it could be coated tablets. Okay. So most coated tablets are basically meant for chronic diseases like anti-epileptic, higher class of antibiotics, or anti-diabetics, or anti-cancers. So we need to consider it, and we need to take some precautions for the coated tablets. Unlike the uncoated tablet, for example, paracetamol, crocin, dolo, or calpol, all these tablets you can just take it with water, even if without breaking, even if it's break or even if it's cut into pieces. Not much issues for that. But for the main problem is when it comes to the coated tablets. Okay, so coated tablets means it is coated with some film to avoid fast absorption, just to get a slower absorption rate in the body, to reduce the absorption rate, distribution rate, so that it could be distributed in the body slowly, like for throughout the whole day or 12 hours mainly, so that we can avoid maximum consumption. So we must swallow it wholly, and we must not cut it, and we must not break it either. Okay, then next we'll go to the capsules. So even this capsules are of different types. Again, this is the full capsule, one part capsules, and some part will have two, like the picosules, amoxicillin capsules, which has two parts, top and bottoms, yellow or red, or orange or black. So those capsules must not be opened or cut or break as well. We must take it wholly with water. The water is the best. So next is so we'll talk about the drops. This could be like your ear drops, eye drops, or your nasal drops. So any drops needs to be consumed or used within 1 month after opening the cover, after opening the lid, because they are one of the most sterile products. So it could get contaminated within 1 month, so we need to use within 1 month after opening the lid. So while using eye drops, wait, I'll demonstrate it once. For using eye drops, we need to know some, like while using the eye drops, we need to put it here between the cornea, between the white part of the eye. Okay, now we'll demonstrate how to use eye drops. Okay, first we need to install it here between the eyeball and the eyelid, and blink for 2 to 3 times, and keep it for like 5 to 8 seconds. Yeah, this is the best way to use eye drops. Okay, for better absorption and better result. And then we'll talk about syrups. Those syrups like cough syrups and your antacids like Algel, Digene, or your Gelusil. using or drinking water while using those syrups is not much recommended, but if it's irritating or some discomfort is there, you can take 1 to 2 sips of water, and this will increase the absorption and better results for the organs. And about the storage, okay, all the pharmaceutical products and even your cosmetics must be kept under 25 degrees Celsius in room temperature, and must be kept away from light and heat. And then drinking alcohol is the most drinking alcohol causes the risk of damaging the organs, like especially the liver, and causes stomach gastritis or ulcer in the stomach as well. And we must avoid drinking fruit juice like grapes or grapefruit, or even the juice is not recommended while using any sorts of medicines. Or you can consult your physicians or your pharmacist for more details for that. And okay, this much is for this episode, so thank you for watching. And if you can like and subscribe for more videos and for more health tips or more videos to come. And if it's worth sharing, you can share it. And if there's any queries or anything which I missed out, you can get back to me or comment below. Okay, thank you for watching again.